All right, I'm gonna walk in the room. I'm gonna provide for privacy. I'm gonna wash my hands. I'm gonna put on gloves. I'm going to introduce myself to the patient. Hi, my name's Cadence. I'm gonna be your nurse today. How are you doing? Can you tell me your name and your birthday?
Brenda Wilkerson.
Awesome. I'm also gonna check her
May
armband.
10, 1959.
Thank you. I'm gonna check her armband. I've done this so many times right now, and the baby crying isn't helping. I'm gonna check her armband for 2 client identifiers. Provided for privacy. I'm going to do a head-to-toe assessment today. We're going to start at the top, work our way down. If anything hurts, just let me know, okay? All right. Well, he was happy a few minutes ago. He'll be okay for the next 3 minutes, hopefully. I obtained the vital signs. They're within normal limits. Are you in any pain today?
No.
Okay. Can you tell me what day it is?
January 25th or 26th. It's Sunday 2024.
Just tell me the year. Sunday, 2024. Can you tell me where you are?
I'm my home in Charlestown, Indiana.
Thank you. And who's the president?
Biden.
Awesome. Okay. So I'm going to start at the top. Now I'm going to check her hair. I'm going to check for any lesions. I'm also going to check for any pressure ulcers, lice, making sure her head is symmetrical, any bumps, anything like that. While I do that, I'm going to check her ears. I'm going to inspect. I'm going to feel them. I'm going to check behind them. Have you had any pain in your ears?
No.
I'm going to check for any wax, any drainage, anything like that. The same with her nose. I'm going to look. Can you open your mouth? Make sure her mouth is moist. Okay. Everything looks good there. I'm going to check her carotid. One side, and I'm going to check it on the other side. Okay. I'm going to go ahead and check all the pulses while I'm at it. So I'm going to check her radial pulses. This is maybe this is school from now on. Behind her knees, I'm going to check her dorsalis pedis. You can rest your arm, that's fine. And then posterior tibialis, I'm sorry, and the dorsalis pedis right here. I'm going to go ahead and check her hand strength. Squeeze, thank you. And can you push up on my hands? And down on my hands. Great. I'm also going to check the skin turgor. Make sure, as I'm doing this whole thing, head and bottom, head to toe, I'm going to be checking her body for temperature, color, make sure it's moist in the right areas like I did up there. Check for any bruising, any petechiae, any pressure ulcers, anything like that, any lesions. I'm going to go ahead and listen to her heart. Actually, I'm going to check her eyes. Make sure, check for accommodation. I'm going to make sure that her eyes are, go ahead and look at the light for me. Actually, look at my nose, not the light. Make sure they are equal and reactive to light, which for the 4th time we've done this, they are not reacting to light. It's fine. And I'm going to check the cardinal gazes. Just go ahead and look straight ahead and keep your head straight for me and keep an eye on this, okay? And I'm checking for nystagmus, making sure her eye muscles move evenly. She always has issues with that one. And this, okay, good job, thank you. And then I'm going to listen to her apical heart rate, which is the midclavicular line, the 5th intercostal space. They keep twisting. Which is right around the nipple line typically in most people. On female patients with bigger breasts or female patients in general, typically ask them to lift their breast up if you need to get to it. And you're going to listen for a full minute. And then I'm going to listen to her lung sounds on the front. So we're going to listen to 1, 2. I'm going to listen for a full breath in and a full breath out each time. 2, 2, 3, 3, 4, 4, 5, and 5. All right, Ace, if you want to come behind me so we can get a picture of her back. So you gotta be, there you go. So we'll listen to her lung sounds on her back. Again, a full breath in, full breath out each time. I'm gonna start right here. It's hard to see from this angle. Listen there. 1, 2. We're gonna go down here. 3, 4, 5, 6, 7, 8, 9. I can hear the baby through this. 10, 11, 12, 13, 14, 15, 16, 17, and we'll hear 18 right there. All right, have you had a cough?
Yeah.
If she has had a cough, I would ask her if it has been productive or non-productive. You can come back around this way for me. Thank you. I'm getting all the kids' toys in the background. And then I'm going to go ahead and look at her abdomen first, and then I'm going to listen. I'm going to listen in the right lower quadrant first, and then the right upper, and left upper, and left lower, and then I'll palpate. Ask about her last bowel movement, the characteristics of that, if there was any pain, and then I'm also going to check her bladder for distension. Make sure, ask her the last time she voided, if there was any pain with that. Again, I'm going to do the whole bottom part of her and assess again to make sure everything was fine. I'm not sure if I did this, but I'm going to check her cap refill and her fingers, and also do her toes. I'm going to check the curvature of her spine to make sure it's straight, and I think that's it. Okay, you can stop it.